Welcome to the benefits presentation for PreFix. Benefits will begin June 1st, 2025 through May 31st, 2026.
The Insurica team. My name is Sandra Quintanilla, the Senior Account Executive for PreFix. And PreFix has partnered with Insurica to create a more personal experience when dealing with your employee benefits. The Insurica team is a resource for you and your dependents to call with benefit plan, provider, or claims questions. All employees and their covered dependents have access to the Insurica team for help with claims resolution or benefit questions. My direct number is 512-381-8397, or you may reach me by cell phone at 512-680-6243. You may also email me at sandra.quintanilla@insurica.com. Now, our business hours are from 8:30 a.m. Central Standard Time, Monday through Friday. However, I am going to be available on the weekends or before or after hours if you do have any benefit questions.
Who is eligible for benefits? All full-time employees who work at least an average of 30 hours per week could cover your spouse, domestic partners, children up to the age of 26, regardless of student status or even marital status. You may make changes to your elections during the year if you have one of the following status changes: marriage, divorce, legal separation, gain or loss of eligible dependent for reasons such as birth, adoption, court-ordered disability, death, or reaching the child dependent age limit of 26. Children are covered up to the age of 26, regardless of student status or even marital status. Your benefit change must be consistent with your change in family status. If you should have a life event throughout the year, please reach out to the Insurica team or to your Human Resources Department as well. These are IRS regulations, and these enrollments are above must be submitted to Insurica within the 30 days of that qualifying event. The medical plan will be administered by Curative. The medical plan will be administered by Curative. Curative is making healthcare work the way that it should. In response to the pandemic, they looked things differently and reinvented a health plan for post-pandemic world built around affordability, engagement, and simplicity. With Curative, there is no copay, coinsurance, or deductibles for in-network care as long as you complete a baseline visit within 120 days of your enrollment. Again, $0 visits for doctor's office, $0 for preferred prescriptions. So zero copay, zero deductible, and zero out-of-pocket costs. Let's go ahead and review the medical plans that are available through Curative. The network is the First Health Network. When searching for an in-network provider, make sure that that doctor is contracted with the First Health Network. You always want to ask, are you contracted with First Health? They may not be familiar with Curative, but the First Health Network is a national network. Now let's review the first plan. The first plan is an EPO, Exclusive Provider Organization. This means that you only have in-network coverage. If you choose to go out of network, there is no coverage that's available. However, if it's a true medical emergency, it may be covered in-network. The in-network with a baseline deductible is $0. The in-network without a baseline visit within the 120 days is a $5,000 individual deductible or $10,000 for family. The in-network with a baseline out-of-pocket maximum is $0. The in-network without the baseline out-of-pocket is $7,500 for an individual and $15,000 for a family. Again, there is no out-of-network deductibles and no out-of-network maximum out-of-pocket because there is no coverage. You are required to have a care navigator. This care navigator will help you navigate through the First Health Network and also help you find and complete your baseline visit and meet with a physician. The virtual visits within urgent care are 24/7, 365 days a year. The wellness benefit for chronic conditions and acute care management are also available. For the PPO plan, you do have in and out of network coverage. Again, for the in network with the baseline deductible is $0. In network without the baseline deductible is $5,000 for an individual and $10,000 for family. The PPO means preferred provider organization, and you do have in and out of network coverage. The in network baseline visit is out and out of pocket is $0. The in-network without the baseline out-of-pocket maximum is $7,500 for an individual and $15,000 for the family. The out-of-network deductible for an individual is $10,000 and $20,000 for a family, and the out-of-network maximum out-of-pocket is $15,000 for an individual and $30,000 for a family. Again, a care navigator is required and will help you navigate through the curative system. Virtual visits through urgent care is 24/7, 365 days a year, and the wellness benefit for chronic conditions or acute management is also available. The PPO Max is also available to employees. You have in-network deductible is $0. In-network baseline deductible is $5,000 for an individual, $10,000 for a family. The in-network with the baseline out of pocket is $0. In-network without a baseline out-of-pocket is $7,500 and $15,000 for family. Now you want to keep in mind that if you do go out-of-network, you will be balance billed both on the PPO and PPO Max plan. Out-of-network deductible is $5,000 for an individual and $10,000 for family. The out-of-network maximum out-of-pocket is $7,000 per person or $15,000 for family. It does include a care navigator as well. Again, the care navigator will help you navigate through the curative system and help you find a first health provider. The virtual urgent care is 24/7, 365 days a year. And this plan also includes the chronic conditions, acute management, and chiropractic services. So the PPO Max does cover chiropractic services. And the Class Pass, which includes discounts for chiropractors, gym passes, and also acupuncture, is also included in this plan. Curative is committed in helping their members get the most out of their health plan from day one. Curative members are invited to participate in the baseline visit to help get their guesswork out of their health plan. By completing a visit within the first 120 days, members continue with a zero out-of-pocket cost for in-network care and preferred prescriptions. Now here are a few important things to know. The baseline visit is 100% cost-free. Results and conversations are completely confidential. The results will not impact the cost of your health plan or the insurance premiums. Visits are typically within between 45 minutes to an hour. Now, this doesn't replace your annual physical exam. Don't worry, they'll help you schedule one as well. With Curative, you also get a care navigator. Learn all about the new plans and benefits that they have to offer. Get support on finding an in-network care 24/7, 7 days a week, 365 through telemedicine. They'll help transfer your prescriptions to an in-network pharmacy. You could also get connected to programs to help reach your health plan goals. If your care navigator is unavailable, you'll also have access to 24/7, 365 access to members at 855 for Curative. You could also meet with a clinician Members who meet with a clinician can discuss any healthcare goals or needs. You could review medical history, measure vital signs, and then also conduct a blood test and get immediate results. Now let's get some minor details covered. If they are under 18, your dependents will also qualify for the zero copay and zero deductible with your completion of your baseline visit. Members 18 or older will need to complete their own baseline visit to qualify. They may make an appointment through the member portal as well. Now let's go through one example. Claire is a primary subscriber of Curative Health Plan with her spouse Terry and their 15-year-old son Joe, who's enrolled as dependents. Now, who needs to complete their baseline? The primary subscriber, Claire, also with her spouse Terry, will need to complete a baseline for both of them to unlock the $0 in network coverage. As long as either Terry or Claire complete their baseline, Joe will not need to complete one since he is under the age of 18. Let's review example number 2. John serves as a primary subscriber, while his spouse Susan and their 18-year-old daughter Lucy are included in the Curative Health Plan as dependents. Now, who needs to complete their baseline? John, Sue, and Lucy will need to complete their baseline individually to unlock the $0 in network coverage since they are all over the age of 18. 18 or older will need to complete their own baseline. Let's review the third and final example. Now, Maddie is the primary subscriber of Curative Health Plan. Her spouse, David, and 2 children are enrolled as dependents, a 22-year-old son, Chris, and a 12-year-old daughter, Sydney. Now, who needs to complete the baseline? You're right. Maddie, David, and Chris will need to individually complete their baseline to unlock the $0 in network coverage. For Sydney to receive the $0 in network coverage, either Maddie or David will need to complete their baseline. Please note, Chris cannot complete the baseline for Sydney to unlock coverage, since it only could be the subscriber or the spouse, not the dependent child. It's important to jot down these numbers. Get support when you need it. Curative member services are available again 24 hours, 7 days a week, 365. You could simply save this number to your phone at 855-4-CURATIVE. That's 855-428-7284. Your questions will be answered. Curative works around your schedule with member support, again 24/7, 365. Curative in-network benefits. Maximizing your benefits with Curative by utilizing their in-network providers and completing their baseline visit within the first 120 days from the effective date. Now, a couple of things that we need to go over is the coverage annual deductible. That amount you will have to pay out-of-pocket costs that are for covered healthcare before your plan begins to pay. Coinsurance percentage. This amount will be the covered services after your deductible has been met. The annual out-of-pocket maximum for the medical is your expenses for the medical care that are not reimbursed by insurance. Lifetime maximum. The dollar amount for the insurance company will pay if benefits for as long as you are enrolled in the plan. Now we're going to go over Curative in-network baseline and what your responsibilities are, and Curative in-network and Curative out-of-network. So if you are non-compliant with the baseline, you will have a in-network Curative deductible and maximum out-of-pocket. If you go out-of-network, you have a separate deductible and a separate maximum out-of-pocket. So it's really important to get that baseline visit within that first 120 days from your effective date. Quality coverage for quality care. Curative has one of the largest provider networks in Texas and a strong national network including physicians, care professionals, and care facilities. Easily locate in network providers near you by using Curative's provider search tool at curative.com/get-care. Now there's national network again, but there's also about 173 hospitals, 11,000 facilities, and over 65,000 professional providers just in Texas alone. Make the most of your pharmacy benefit. Get your baseline visit within the 120 days of your enrollment. Stay in network and get a preferred pharmacy including Curative and HEB locations. Additional partners are available outside Texas and nationwide as well. Use your drug search tool at health.curative.com/drugs to see what is covered under your health plan. Curative has made seeing a doctor from your comfort of your home so easy. 24 hours a day, 7 days a week, 365. Now you could experience the convenience of a virtual urgent care and connect to a Texas physician in 10 minutes or less. You have direct access to participating family doctors and pediatricians, messaging, audio, or video chat, and this will be all with a $0 copay. Life is typically unpredictable, but we like to go ahead and provide 3 different possible scenarios. Now let's review. Peg is having a baby, 9 months of in-network prenatal care, and a hospital delivery. Traditional health insurance, examples of a cost is typically around $13,000. With Curative, it'll be $0. Now Mia has a simple fracture for an in-network emergency visit and maybe even just one follow-up care. A traditional health insurance example cost is typically around $2,800. For Curative Health Plan, it would be 0. Now, managing Joe's type 2 diabetes, a year of routine care as well as controlled condition. The traditional health insurance example costs around $5,600. With Curative Health Plan, it will be 0 cost. Now, as a friendly reminder, members must complete a baseline visit within the first 120 days of enrollment in order to qualify. Your healthcare tools and resources are always within reach. You'll have access to digital Curative ID card, download, print, and request a physical ID, view your pharmacy and care benefits, update your personal information, and also register and connect to a virtual urgent care. Here's a few things to expect after your enrollment. You want to register to your account through the member portal. You can download and print your ID card, view your pharmacy care benefits, and update your personal information. Don't forget to register and connect to the virtual urgent care. Now, once you sign up for the virtual care, you'll have access to family doctors and pediatricians. You could have prescriptions available to your doctor, and then also this will be a 0 cost copay. So in addition to registering for the member portal, you'll receive a sign-up email with a virtual urgent care through NormMD. Curative members based in Texas will receive access to a doctor within minutes, no appointment needed. And the third step, don't forget your baseline. By completing your baseline within 120 days of your visit, effective date, you'll keep 0 copays, 0 deductibles for in-network care, preferred prescriptions, For more information, you can go to curative.com/baseline. Members can sign up from their visits through their member portal at health.curative.com.
Here's a creative and a guarantee for in-network care. Now, as members navigate through the complex landscape of health insurance, we understand the challenges employees face when seeking in-network healthcare, especially when providers are not familiar with Curative Health Plan. That is why we're now introducing the Curative Zero Card. This is designated to streamline the simplicity of the member's experience. Now, as you know, the challenges of healthcare can be complex, and going onto the provider directories can be outdated and leading to potential issues for potential healthcare professionals and patients. Now, some of these providers may mistakenly believe that they don't accept curative, even if they do. Now, this confusion can result in unwarranted denials and inconvenience to the members. Now, the solution is the zero card. It is to address the challenge that members receive the zero card so they could access in-network coverage without having to deal with any potential problems. Now, how this works. All members receive a digital zero card or a physical one upon request only. So you must go onto the in-network portal to curative.com and to make sure that your doctor and pharmacy and your physician is in network. Now, in some instances, when presenting the Curative insurance card, the provider does not know who Curative is or in network or with the First Health and is unwilling to accept the insurance. Now, the member could call member services to verify the in-network status. This is extremely important. You must call Curative to make sure that this provider is in network. Now, the members will present the zero Curative card during the appointment's payment process. The in-network benefits are applied seamlessly and ensuring a worry-free experience. So it's really important for you to make sure that you call Curative, make sure that the provider is in network, and they'll go ahead and turn on that digital card and make it easy for you.
There is a Curative Pharmacy, same as our next day delivery in Austin, Dallas, Houston, and San Antonio. Coming in 2024, same day and next day delivery in Temple, Orlando, and Miami. There's overnight deliveries in states including Indiana, Wisconsin, and Florida. But there's also national pharmacy options as well. HEB, Publix Pharmacy. Now, if you do not see your in-network pharmacy, not to worry. Please go in and to Curative and you can find alternative custom options using our extended network. Curative's pharmacy benefit makes it easy to stay healthy and save. Get your baseline visit within the 120 days of your start date. Visit an in-network provider who prescribes you a preferred medication. And then use your preferred in-network pharmacy. Preferred drugs consist of generic, select brand, and specialty medications. Non-preferred consists of a lower value of generics, brands, and specialty medications. The preferred medications is a $0 copay. For non-preferred drugs, it's a $50 or $250 copay.
The dental is going to be administered by United Healthcare through the All Savers.
Let's review your voluntary dental plan with United Healthcare. The network is a PPO, Preferred Provider Organization, and you have in and out of network coverage. It is best to stay in network and see a contracted dental provider. The individual deductible is $50, and for the family it's $150. It is per calendar year, so it'll reset every January 1st. The deductible is waived on preventative services. Calendar year maximum is $1,000. Preventative services are covered at 100%. Basic services are covered at 80%. Major services are covered at 50% after waiting period has been met. Same thing for periodontics and endodontics. The major waiting period is 12 months.
It's extremely important to find an in-network dentist with United Healthcare. Utilizing an in-network dentist will provide you the best benefit. Above is an example of in-network versus out-of-network coverage. Now, the in-network dentist has agreed to set a contracted rate with United Healthcare, and the out-of-network dentist can bill you the amount that they are charging above that contracted rate, also known as balance billing. So it's really important for you to find a dentist that is contracted with United Healthcare. A few helpful tips. Dental cards are available on the United Healthcare portal. Using an in-network dentist is extremely important. Teeth cleanings are every 6 months. Make sure your dentist does a predetermination when the treatment is expected to exceed over $300. So it's really important to make sure that that predetermination includes any labs or x-rays that the insurance will need to ensure that that procedure will be covered. The vision benefit will be administered by United Healthcare. The vision plan is also administered by United Healthcare. The exam is a $10 copay. The lenses, bifocals and trifocals, is a $25 copay. The standard polygranate anti-reflective coating, those are $25 copays. For contact lenses for fit and follow-up is up to $55, and the contact for elective is $105 allowance. You do have exams covered at every 12 months, lenses every 12 months, frames are every 24 months, and contacts are every 12 months. Now, it's always best to stay in network. If you go out of network, you will be reimbursed to an allowable charge, so it's always best to stay in network. And the rates for vision are 100% employee paid. It's $6.22 for employee only. Employee and spouse is $11.79. Employee and children is $13.83, and employee and family is $19.48. Now, the vision plan will cover glasses or contacts, but not both.
PreFix will be using EASE portal again this year for the open enrollment. You'll be receiving an EASE email by the end of business day on 5/10. If you have not received an email, please notify Sandra Quintanilla with Insurica, and we'll be happy to help you and guide you through the portal. Again, once you see the benefits enrollment, you'll see start and make your elections. Again, this process takes about 15 to 25 minutes. Make sure that you have your dependent information ready, such as dates of birth or an address change. On the portal, it will actually guide you to make your elections. Again, please review the profile, dependent information, and then include who you might want to make those elections for, whether it's yourself, your spouse, or for your children. The final steps for your enrollment is creating a signature. Once you sign those signatures, then your enrollment will be complete.
Here's a few friendly reminders. Everyone must enroll or decline in the EASE benefits portal. The deadline to complete the enrollment is May 23, 2025. The Insurica team is here to help you and to support you.
After this presentation, you'll receive an email through the EASE portal. Please do not hesitate to reach out to myself, Sandra Quintanilla, with the Insurica team to help you with any benefit questions that you may have. You must elect or decline coverage on the EASE portal, whether you're accepting or declining coverage, and that would be including medical, dental, and vision benefits. Thank you so much and have a great day. And again, please reach out to myself, Sandra Quintanilla, or the Insurica team if you have any questions regarding your employee benefits.